Hey guys, hope I'm audible and visible. If so, say me hi. It's a very informal session what we're going to have. It's ask me anything. I'll take your queries one by one and I'll try to explain it for you. Okay, mind gamer, you're in class 12th, all the very best for your NEET UG. I'm very excited to teach all of you guys when you come to MBBS second year. Hello, Barnak. Hi, good evening. Aryan, Aryan, I'll look into it. Are you talking about the second year essentials batch? If so, definitely I'll let you know. Okay, Barnak, when you take pathology as such, pathology is a very vast thing, fine. So when I say it's very vast, it's about what happens in any disease ever known to mankind. So I want you to read the template. Reading the entire pathology is not required and it's impossible as well. So you know a template. If you know a template, let's say it's an inflammatory disorder. Obviously the same inflammation will be the same if it's in heart, lung, liver, everything. So the application is very important rather than reading everything verbatim, word to word, right? So you learn the concept, apply to liver, inflammation, hepatitis. Apply to lung, inflammation, pneumonia. Apply to any organ, that's how you read it, fine? Very good evening, Rahul. Okay, Sunny, how to make the best use of clinical postings? How many of you in your gone to your second year of MBBS and started your clinical postings? I would say the first half of the clinical posting, just observe, don't do anything. The first 3-4 months of clinical posting is for you to get used to how to interact with a patient, a normal human being, that's all. Not to diagnose, nothing. Just listen to them, listen to their complaints, learn how to talk to patients, the bedside manners, and see your seniors how they are presenting. Right? And very carefully listen to their complaints, because that is what is going to make you the best clinician in whatever field you choose. Right? I'll take one by one queries. I'll a little bit go fast. There are lots of things. Tajuddin, the best MCQ book for pathology, I would say Robbins has a review book. It's available free for download on internet. Just Google Robbins review book for MCQs. It has good number of MCQs based on the chapters of Robbins. That's by far the best book available on the market. Okay, Kushal, anatomy I went with BD Chaurashia. Physiology I am a big fan of Guyton. I love Guyton. Biochemistry I went with few topics with Harper. I won't tell lies that I went entirely to Harper. Few topics from Harper. Rest everything is Vasudevan. That's good. Very good book as well. Okay. Devsama, for cracking NEET UG, there are way better teachers in PW who can advise you than me. So definitely, please get their guidance. I will help you in acing your MBBS and NEET PG once you join the MBBS. Fine. Amazing, Rashi. Hope I can instill more and more interest towards pathology and medicine, and hopefully you will be learning more things. And please teach us back as well, because you guys are very smart than we can ever be. So I'm looking forward to learn from you guys as well. Okay, Parth, I would say go for the bigger book, which is 2 volumes. You need not go to the international edition, go with the Southeast Asian edition. That's a very good resource of book. It's the same book initially. Due to the ease of usage of students, they have divided into 2 volumes, right? Don't go the shorter book. The bigger the book is, any day it is very good for you to grasp the concepts and to implement them and come to a diagnosis. I'll definitely come up with a series of how to read Robbins, and hopefully that will help you remove the fear of Robbins. Robbins is a very doable book. It's not difficult at all, like most of your seniors used to say. We'll definitely read Robbins together and we'll excel Robbins together. Right? Okay, doctor's wedding. How to make short notes for NEET PG. See, NEET PG is a very simple exam. NEET or next, whatever you're going to write. Because ultimately, NEET or next exam is going to concentrate on how to solve a patient diagnosis and treat. So let's say you are reading any topic in any subject. Your goal is only one thing, because in future you're going to sit in a clinic and you're going to diagnose patients. So always keep that patient in mentality. Never ever remove the patient. Whatever you read in your life, it has to be linked with the patient, diagnosis, prognosis, treatment. If it is not linked, don't remember. So whatever you feel, let's say I am reading about megaloblastic anemia, B12 deficiency anemia, and there's a point which says that the difference between B12 and folate deficiency is neurological deficit. Highlight them, make them in notes. So that's what is going to help you on a long run to make a better notes for any competitive exam. Please remember, your goal is only one thing: your final year exam, your patience. That's all. Okay. Vijay Kumar, I exactly don't know on the top of my head what will be the penalty if you leave MBBS at a final year. You have to look at the prospectus when you join, because it keeps on changing every now and then. So, like I said, I'm not the right person to answer, but definitely give me some time, ping me on Instagram. I'll definitely help you with that as well. Zoro69, the first chapter of Robbins, which has all the growth factors, everything, it's not required for you at this point of level. When we go with the live batches, I will interlink those things. See, if you go to the first chapter, there'll be a little bit part of genetics. We'll read them in genetics chapter. There'll be a little bit of growth factors. We'll read them in neoplasia chapter, right? I would say the first chapter of Robbins is not much required. It's a continuation from whatever you read in biochemistry. Ignore them and start from cell injury chapter. Okay, Anston, for the anatomy thing, you will have a re-recording done. You will have much more clear topics and explain topics in anatomy. I'll ask Pradeep Pawar sir to connect with all you guys, and definitely the course will help you to sail up through your university exams. Med RV, for me, medicine book, the best book for me, as per me, is Davidson or Harrison. Either one, whichever you prefer, whichever you feel is right, go with that. I'm okay with both Davidson and Harrison. Harrison is very voluminous, Davidson is more diagrammatic. Right? Sakshi and everyone, what's my review on Hashmogan? Let me be very frank about it. See, I'm not saying Hashmogan is a bad book. It's an amazing book. There's no doubt about that. I'm not against Dr. Hashmogan also. He's an amazing pathologist as well. My only difference between an Indian author book, be it any subject, versus a foreign author book. If you take Robbins, every chapter of Robbins is written by 5 or 6 people. Every chapter of Harrison is also written by 5 or 6 people. So when I read the entire Robbins of 20 to 23, 20 chapters, I'm going to get the experience, insights of hundreds of renowned doctors. On the other hand, when you take any Indian author book written by an individual, you get the experience of one doctor. Honestly, if I have to guide my juniors about it, I would say any day a foreign author book, because it's an amalgamation of knowledge of 100 authors. That's any day superior to anyone. Even if I write a book in future, I would say Robbins is better than my book. Because that knowledge of authors you will not get in any Indian author. That's the only reason I'm saying little bit to move away from Hashmogan. Please stick to Robbins, at least in the general pathology. Maybe when you come to other things, you will get a hold of it. You can go with any other book. Tajuddin, Robbins is good enough for hematology also, but hematology is a little bit less explained in Robbins. Stick to the PW thing, which will give you irrelevant details to the real life, what's happening in reality, rather than any other book in the market. Because hematology keeps changing every year, so no book can update it every year. At GMC, there's no different ways to study the same topic. I would say that for every student out here, don't adopt different ways to study the same topic. I would say that it's very simple. Keep in mind, I'm going to study a disease. If I do the same way every single time, at the end of the day, my revision is going to be very stable. I'm sure everyone must have remembered Bruce Lee's quote. I'm not afraid about a person who knows 10,000 different kicks. I'm afraid about a person who knows one kick who has practiced it 10,000 times. So stick to the way of reading. My way, your way, whatever suits you, and please make sure you revise them so that you never go outside of the topic, right? So that you remember everything what is required. At the end of the day, like you said, it's about diagnosing a patient. So you repeat the same thing, there's more high chance of you remembering and successful in diagnosing the patient. Hemalata, if you take Robbins notes and you read, that will be the best thing, because only reading, it's a voluminous book, it will be very difficult for you to revise. Either mark in the notebook or take notes, anything is okay, but taking notes is always better. Vaibhav, pathology is a study of disease. Anish, if you're asking about short notes in your university exams, we'll have Faray series at the end, close to the end of your year. That will help you to think and write how to prepare for a short notes. But if you're talking about notes making, like I said, I will help you with a read with me Robbins series. So that in that I will tell you how to exactly make notes to become a better doctor. Not to crack next exam or NEET exam, because our goal is only one thing always: become the best doctor of yourself. NEET exam first rank or next exam first rank is a byproduct of that. Jai Shri Ram Jaksi. I'm answering one by one questions of yours. Fine. So give me some time. Aryan, I will definitely come back to you. It should be for 14 months. I'll get back to you. If it's about the PW Essentials batch, just comment on that. I'll definitely ask that. Okay, Rajeshri, English. This is for every student out there. Fine. I did my school from a government school, right? So I was not very good in talking in English. I'm not very good even conversing. I was extremely an introvert. The first Viva I attended, I still remember my anatomy HOD asking me questions. I know the answer, I couldn't answer her because I was a bit. It's from school days to college days. You feel the inferiority complex, especially when you go from a. I studied from a town. From that town to go to a metropolitan, it's a very big change. I still remember my anatomy HOD at the end of Viva. She asked me, "Please tell me your name." I was not able to tell my name. So what I'm trying to tell here is, if you are able to clear your physics, chemistry, biology and come into NEET UG, and if you're able to clear your anat physio biochem in first year, English is nothing. Language is nothing. If you can clear medicine, 100%, maybe put 1000%, you'll be able to excel in any language. At the end of the day, you're going to deal with the patient in your surroundings. Whichever state you are, mother tongue is more important. If you're excelling in the mother tongue, that's more than enough. Don't worry about in English. It's just a language. You'll definitely overdo that, right? Viber, iPad, it's totally your call. A notes taking is required. I am still an old school person. For me, pen and paper is any day superior to any gadget. If you are comfortable with iPad, because your generations, we have a big generation gap. If you're comfortable with digital media, go with anything. iPad is also a good one. Tajuddin, yes, for USMLE also Robbins is more than enough. The only thing with USMLE or NEET or next PG is the pattern of questions. You read the basic concepts from Robbins, make your concept stronger, and then please go and solve the UWorld or some question banks for USMLE so that you are getting used to that. That's the only difference between USMLE and this. Path, you be the change person who's going to create the change. You read Robbins, complete Robbins, and tell to all your juniors Robbins is doable. Right? It just needs one person to make the change. If you tell to your juniors will say, Parth sir said I can do it, they also will do it. 10 of your juniors does it, the entire batch in next 5 years will read only Robbins. That becomes the gold standard any day, right? Just give me a few seconds, guys. There are lots of queries. I'm attending one by one. Jane, Sushil, I'll definitely come up with a series of lectures where I'll be discussing about how to read Robbins. You'll read Robbins with me. I will tell you the way I read during my MBBS, during my MD, and just try to follow that. It'll be more than enough for you. Fun with Duru. As a teacher, if you read textbooks, I would never say no to that. My lectures are going to help you to understand and make Robbins better and easier, that's all. But if you can read Robbins, salute to you, and that will be great. Sarita, dysphagia is not a right thing. Please go and visit the nearby physician available to you. If you are an MBBS student, please go to the hospital OPD and get tested. What is the reason for dysphagia? Rohan, yes. See, NEET PG or next, whatever it is, the ultimate thing is to make sure your basics are strong. If your basics are strong, any day you will be excelling in the exam. So make sure your basics are strong here. The reason why we have DPP after every lecture is making sure you learn the concepts and you apply in the form of MCQ. NEET PG is just about MCQs, right? More and more you practice, you become better in that part, that's all, right? So definitely this batch will help you to thrive and do very well in NEET PG exams or next exam. So go ahead with confidence, just do the work, results will automatically follow. Okay, Anish, what routine to follow exactly in second year till NEET PG for Pathopharma? Fine. So first thing, Since you're in second year, I hope you're in second year. If you're in second year of MBBS, I would say that stick to your second year now. Morning, attend your postings religiously. Observe the patients, learn the art of history taking. Afternoon, you'll have colleges and you'll have the PW classes. Attend them, read them regularly. Please don't keep it till the university exams or till your internals. Read them on a daily basis. Daily basis, 1 hour of reading is more than enough. Read consistently. Let's assume you're reading in microbiology patient about viral hepatitis. You see in medicine what a case of viral hepatitis, revise them. That's how you revise. You read something, you see that it automatically gets ingrained in your head. So do this continuously till the end of second year. That should be more than enough. So what to do for NEET PG is, once your base of path, pharma, micro is done, when you go to your final year, medicine, surgery, OG, pediatrics, ENT, ophthalm, everything in this will have drugs. Whenever you read them, remember pharmacology, revise. Every disease will have pathogenesis, remember pathology, revise. If it's an infectious disease, will have microbiology, remember that, revise. So the third year and fourth year is full of application. So whatever you read here, in your third and fourth year also, it will automatically be revised, because at the end of the day, you're going to read the same diseases. Diseases don't change. Only the years change, diseases remain the same. So stick to that, fine? Okay. Okay, Tajuni, you want to know about myself? Okay, fine. Let me tell about myself. I did my UG from Keelpok Medical College, Chennai, and I did my PG in pathology from Jimma. After finishing my PG in pathology, I was working as a senior resident in Jimma for 6 to 8 months. When I moved to Bangalore, I was working in genetic diagnosis. Now I am at Chennai. I head a division of genetic diagnosis and research in Chennai at a company called as Ilango Genetics, which is one of my friends' venture. So that's what I've been doing now. I'm more into genetics because it's not something very superb or hi-fi. My thesis in my PG was in genetics. So from that time, just an affinity towards genetics. And to be very, very honest, it's much easier than routine pathology. So I kind of moved towards genetics. And sometimes, rarely, I give second opinions for cancers. These are things I do apart from teaching. Thank you, Sarita. Yes, Rahul, definitely. For third year, we'll definitely come up with something. Maybe in just wait for your exams to get over, get into third year. We'll have live batches for third year also. Thank you, Priya. Uh, One by one, I'm answering all your questions. Hopefully, I'll be answering every question of yours. Fine. If you guys cannot repeat the question, it will be great. Amazing, Parth. Mr. Perfect, I have both possibilities of both iPad as well as board. Let me see. I wish I will be continuing in board. Sometimes when I have to explain something which is more theoretical, I might switch to iPad, because an iPad I can draw the flowcharts better than a board. Fine. Truth teller, I'm also going to tell you the truth. Second year preparation for NEET PG, ignore NEET PG now. That's the best way of preparing for second year NEET PG. Read Robbins, read your pharmacology, microbiology. After every lecture, you'll have DPP, solve the questions, read the subject, finish it here, excel that. Automatically, you're getting prepared for NEET PG. Okay? Okay, my Muna bike, right? I hope I pronounced your name rightly. Fine. Second year clinical postings, I am not sure how your college postings are made. Generally, it will be the first half you'll have clinical postings, second half you'll have your subjects. So the second year purpose of clinical postings are only two. One, to know how to interact with the patient, to know the communication skill, to develop the empathy, to ask, greet, how, and when to talk, when not to talk. That's one most important thing. Second, learn history taking. You need not excel in murmurs. You need not excel in splenomegaly. Please develop the art of history taking. That's enough. Learn how to take history in the first half of second year. 6 months, do only that. Maybe in the next second half, next 6 months, try with examination. S1, S2, enough. Normal breath sounds, enough. Crackle repetitions once in a while. Please understand, the purpose of second year is not to diagnose or listen to murmurs, or to elicit a need, or to see any neurological findings or anything. No normal. How do I do a knee jerk? Learn that. How do I use a stethoscope? Learn that. These basics are the only thing which I want any student to learn in second year. Please do that. That should be more than enough. MNX Studios, I have told this before, you have a textbook based on Robbins, the same Robinson Kotan as an MCQ book, you can follow that, or PWS the QBank, you can follow that as well. Kushal, my NEET UG, I didn't have NEET UG, I had a totally different thing. My days, it was not NEET UG, it was state-wide thing. I think my rank was 144 if I'm not mistaken, because it was Tamil Nadu State UG, and NEET PG it was somewhere around 3000 if I'm not right, because I didn't take go into NEET PG, I went into JIMMA. In JIMMA my rank was around 120. Pratik, really I don't know about offers. You ask me about pathology, I'll definitely help you. If you want, please ping me personally. I'll definitely ask some of the persons, is there any offer in around Republic Day. Fine. Thank you, Priya. Alistair Pinto, pathology is a career. I have put one more entire video on pathology about a career. How pathology will help you think. This is it's a good thing, but it's a long learning curve. You need to be very good and skillful in your diagnosis, and a little bit of managing a clinic if you can learn. Yes, it has a very good scope. Again, every branch in India is saturated, so I have had a separate video on that. Just have a look at that, and if you have any more queries, do let me know. I'll be more than happy to help. Abdullah, we'll learn pathology for the entire year, right? I'll tell you exactly how to identify each and every disease, each and every necrosis, acute inflammation, chronic inflammation. You do not worry about that. If you are with me for the next 1 year, I'll make sure that at the end of this year, you know about pathology. And my only agenda is, if you're with me this year, my goal is you should not look into your pathology practicals outside the microscope. My goal is to make you to look inside the microscope and diagnose things. I hope I'll be able to be successful in there. Sarita, next one resources. First and foremost is complete your basics, complete your books. Then parallelly, whenever you read anything, again like I said, always keep in mind patient diagnosis, management and treatment. Keep that in mind and read whatever you read with alignment to a patient. That's the best thing what you can do for next. Let next come, because there are lots of uncertainties about next. Once the entire pattern model is out, I'll be able to guide you better on that. Ayush, which modules, Ayush, please can you let me know? If possible, I'll help you. Rohan, FARE has been completed for the second year. If FARE happens close to the university exams, right? So now we are starting a new batch. This is for students who have gone from first year to second year, and we'll try to have FARE for you at the end of second year. Satyajit, for me, anatomy was pharmacology. If you want me to choose anatomy or pharmacology, I would say anatomy. No offense to Pradeep sir here. For me, anatomy was very, very hard. Very honest, it was very hard. Rahul, infectious diseases. Please ping me whatever queries you have. I know you are on constant touch with Instagram. Please ping me there. I'll definitely help you out it. Sarita, like I said, next I'm not exactly sure what's happening, so we'll have to wait for the announcement and we'll have to learn for it. Ayush, go with PWQ back. It has good amount of questions and the DPP will add your concepts much more stronger. Satyajit, give me some time. Definitely the third year batch will launch. Oceanic, my favorite movie. My favorite movie. I'm not such a great movie buff, but the recent one, 12th Fail, was an amazing movie. That was on the top of my mind, which comes as 12th Fail. Like I said, my college is Kilpop Medical College. It's in Chennai, and I did my PG from JIMMA, Pondicherry. Definitely MX Studio. I'll give you a very good series on how to read pathology, and hopefully we both will learn more together. Okay, Simar, an interesting question. Though it's not related to academic, I'll take a question. Why not do an FNAC on testicular tumors? What happens is, testis primarily is an intra-abdominal organ, right? So it descends to the scrotum. So the lymphatic drainage of testis goes to the abdomen, pre-aortic, para-aortic lymph nodes. So when I do an FNAC, I'm going to prick the scrotal skin, go to the testis, poke and take it outside, which means the needle tract, the tumor can come to the scrotal skin. If it comes to scrotal skin, from scrotal skin it goes to the inguinal node. So when I do an FNAC on testis, the normal route of spread is to the para-aortic node. I am changing the spread to inguinal node. Since I am changing the direction of spread of the tumor, that's why FNAC of testis is contraindicated. Sure, Manju Kanwar. Most welcome. Deepak, I'll discuss lots and more detail on how to study Robbins as well as the video simultaneously. Like I said, very soon I'll have a series starting at the YouTube for you, all of you guys, how to read Robbins, and let's make the best use of it, and hopefully we will all excel in Robbins, not just pathology. Okay, Ayush, the Faray modules, fine. Please, Ayush, can you ping your ID on my Instagram so that I'll be able to tell the exact status. I'll ask someone in the SSC team to call you and help you out, fine. Please ping me your order ID or something, or your username on my Instagram. It's on Pathology by Ranjith. Please ping me, I'll definitely help you. Samara, Hindi, I have a problem in Hindi. I will not be as fluent in Hindi as in English. हिंदी थोड़ा खराब है, इसके लिए I will talk in English. I am much better in English than in Hindi. But if you have any queries, you can ping me in Hindi. I'll go slow. I'll definitely reply to your queries. But I'm not that fluent in Hindi as in English, right? That's why I prefer English than Hindi. Okay. Rajashri, it really doesn't matter until unless you are within the accepted limit of age. Pratik, if you're going to give next year university, what's FMG, fine. Okay, see Pratik, pathology or medicine, whatever it is, or any subject for that matter, the core is basic concepts. Unfortunate thing is, when a student enters into preparation, they get divided by all these easy shortcut routes. To be very, very honest, there is no shortcut for success. And unfortunately, the student realizes after getting hit in the first attempt. So please learn your concepts properly, revise them, solve questions. Don't shy away from any question. Maximum what will happen, you'll do wrong, you'll make mistakes, right? You make mistakes before the exam so that you don't make mistakes at the time of the exam. That's very, very important. Go with the basics, whatever resource you follow. I'm okay with any resource. Any resource you follow, stick to that resource, learn the basics, solve the question, trust the process, results will automatically come. Satyajit, next confirm or not, no one knows. Nippo Singh, I am not the right person to talk about that. Maybe you would need a one-to-one discussion with an eminent person who is an expert in the field. They'll definitely be able to help you with. Bangalore, Sulpa Aryan. I know Kannada a little bit. Again, the problem is one side of the language development of the brain is not so much. So if you talk in Kannada, I can understand that and I'll try to reply in English. Jane, if you're in second year, I would say go with Robbins for pathology, Ananthanarayan Panikkar or Appu Shastri for microbiology, and Tripathi for pharmacology. Though Dr. Ankit and Dr. Mamta will be the best for their thing, their subject, but this is my opinion. Definitely JP is a good publisher. Thank you, Sarita. Rahul, I did answer your question. Please, if you have any queries, do ping me. I'll definitely give you an entire disease explanation in voice note so that you can definitely learn about it. Right? I know my Hindi is very bad. Ayush, the best person to give you blessings. My blessings are always with you. But there are two amazing souls at your home, your mom and dad. Their blessings is more than enough in this entire world to conquer anything in the world, right? Them first, then me, right? We have a slogan, right? Mata, Pita, then Guru, right? So first, always mom and dad, get their blessings. My blessings is always with any student who is willing to learn. Vikas is an amazing question. What about second year research? See, research in the entire MBBS life has only one goal. It's not to achieve something great. It's to learn the modality of research. First time you do an ICMR research, it's not to discover something, it's not to find out something. It's how to learn what is sample size calculation, what is epidemiology, what is the chi-square test, what is statistics, how do you review literature, how do you write a paper. These are the basic things which the ICMR research is going to give you. Again, I'm repeating, it's not a rare disease or rare topic. Just do a cross-section study on hypertensive patients after taking enalapril, how it's reducing, right? How it's reducing. So based on that, definitely with that concepts of understanding how to do a research, you will definitely improve when you grow to your PG or your super specialty levels, fine? Tajuddin, what words you want in Tamil? Nalla irukkiya? Nalla irukkiya means are you feeling good? Swastik, definitely. I'll suggest I have not forgotten the second year first medal batch. It's always there, right? First will always stay there for a longer time. I'll make sure I'll continue with all of you guys, Swastik as well as Sajat, till the end of your career. Just I'm not aware of the book, so I would not comment on that. Pratik, how to go with CD markers? Please Google or use the YouTube Beasel's journey. There might be some video of mine on Beasel's journey. Listen to them carefully, make notes. That's the best way to remember CD markers. Such as it from first year to final year. I am not the best person to comment on every subject, fine. So I would say that for BD Chaurashya, I am just going to tell whatever books I followed. BD Chaurashya for anatomy, Guyton for physiology, Vasudevan for biochemistry. I am going to with my major resource. Some of the topics here and there I must have referred different books, fine. Pathology Robbins, microbiology I followed Ananthanarayan and Panikar, and your pharmacology KD Tripathi, ENT I followed Dhingra, Ofthal, Kurana and little bit in Parsons, Park for PSM, medicine I was a big fan of Davidson, Harrison few topics here and there but I followed Davidson, surgery Manipal textbook of surgery is what I followed to be very honest, OBG Datta and pediatrics OP guide and other things we know short subjects we don't follow much. Aryan, like I said, I'll definitely get back to you on that, fine? Definitely Rahul, I cannot forget you, don't worry. I will be taking pathology which is in second year of MBBS Sarita. Krishnadas, how to read and revise Robbins. We'll have a series of things in the coming near future videos and read Robbins along with me. I'll tell you exactly how to read Robbins. Sishan, you need not complete PSM and forensic in second year. You will have little bit of portions covered in your college in the second year for both forensic medicine and PSM. Just remember, read them because in third year of MBBS you'll have only these two subjects. You'll have adequate amount of time to take care of that, fine? Because overview of PLAB exam. So first of all, may I know which year you are in? May I know which year you are studying from? Because PLAB, if you're in second year of MBBS, PLAB is having a slight change to one more licensing exam called as UKMLE. I'm not sure when PLAB will be completely replaced by UKMLE. PLAB is a very simple exam to clear. PLAB is not a competitive exam like NEET PG. Once you get a rank, you don't get a seat. So after PLAB, you have to get registered into GMC. After GMC, that's your General Medical Council registration of the Britain, UK. You get registered to that, then you'll have a locum job. Then you'll have to have at least like 4-5 years of training. So it's a long journey. So to start with, the PLAB MCQ part is very easy exam to clear. So don't worry about it. Just make sure that once you are in your final year or internship, see what is the guidelines during that time. So that will help you in planning your career better. Actually, really, I don't remember about my physics or chemistry. It's been so long. You're young. For me, it's like it looks like history now. So I don't want to really remember about my physics and chemistry. Okay, Ayush and someone also asked how to take care of physiology in second year. See, Physiology will never leave you. The only thing is you have to have the eye to understand the physiology. Let's assume you're going to your medicine clinics, fine? You are auscultating lung sounds. So definitely you will have to remember the lung normal thing, breathing. You're listening to heart. You'll have to remember your cardiac cycle, the systole, diastole. It will never leave you. You're seeing a patient with stroke. You need to remember your Broca's area, Wernicke's area. That's your physiology, right? So when you see a patient, undoubtedly my mind is focusing is only the problem. If you focus on the normal, the deviation is the problem. So everywhere in the entire journey of medicine, physiology will be there. It's in your eyes. What you want to see, you will definitely see. So please remember normal. When you see a patient walking, gait is physiology. Patient talking is physiology. You walking and talking is also physiology, right? So remember that whenever you see a patient, if you're seeing a patient with an MI or any murmur, remember cardiac cycle. If you're seeing any patient with stroke, with aphasia, not able to talk, remember normal speech. If you're seeing a patient with Alzheimer's, remember normal memory. That's the best way for me to revise physiology. Daksh, like I said, my 10th and 12th marks were a history. I really don't remember. My 10th marks were 484 out of 500. See, I was in a very old curriculum. It was not like your NEET UG. It was totally diverse. My 12th mark, I think it was somewhere around 1140 or 1145 out of 1200. Lonely Bird, I have a video on YouTube. Please search B-Cell's Journey. That will help you to remember WBC disorders. Pratik and Lonely Bird, B-Cell Journey. I'll just type here. It's a video, it's not on any channel. It's my video where I talked about the entire normal B-Cell's journey. Please have a look at that. Samar, the only difference between university and NEET PG exam is university exam is more of a theoretical exam. NEET PG is a subjective, objective exam. That's the only difference. Disease, everything is the same. Sarita, the first year batch has already been launched. It's going on. You can download the PW Medad app and have a look at that. Okay, job opportunity. It's a very interesting question. Satyajit, I think you're in third year of MBBS, right? To be very honest, when I was in third year of MBBS, I don't even think about jobs, right? You guys are foreseeing things. That's amazing. First of all, kudos to you guys. Job in MBBS, there are multiple things. Once you finish MBBS, your career has different goals. You can either open a clinic. You are good enough to open a clinic. Please don't think that only after finishing MD or MCH you have to open a clinic. Because MBBS is a license for you to treat patients, diagnose patients. You can do that also. You can go as a duty doctor, or you can sit and prepare for an NEET PG. Or if you want a government exam, the UPC CMS comes, you can write that and you can get placed in government central institutes, right? These are the places. Or you can work as a non-academic junior resident in AIMS, JIMMA, PJ, Chandigarh, multiple institutes, right? So these are the opportunities available. So if you want to go with NEET PG preparation, you finish your MD and MS, again the opportunities are very wide, right? So this is in brief about what all jobs you can do after MBBS, and just to scratch the top of the surface of the discussion, right? If you want anything in particular, like I said, just ping me. I'll definitely be happy to help you. Pratik, my review book, I don't think so I'll be writing a book anytime in near future, because when Robbins is there, it's not good for me to compete with I would say the Bible of pathology, right? I'm nothing in front of Robbins. Even if I write something, it'll be very minuscule based on MCQs. The Pathological Basic of Disease Living Fossil. That'll be the best book. Vivek, don't buy a review book. You can Google review book of Robbins for MCQs. It's available free for download. Please go ahead. Rahul, interest with PSM. For everyone sitting here who is going to finish a second year of MBBS or who is near third year of MBBS, how to develop interest in PSM. I'll tell you a very interesting fact. In PSM is always thought like it's a subject which talks about programs, it's a subject which talks about toilets, mosquitoes and everything. It's not like that. PSM is preventive medicine. You must have heard this for sure. Prevention is any day better than cure, right? Any day better than cure. So what PSM exactly does is, let me give you an example. The common cause of fatty liver as of now is non-alcoholic fatty liver disease, which is eating burgers, pizzas, fast food. That's a common cause of fatty liver. 10 years or 15 years back, the common cause of fatty liver was alcohol. So what my government did was said that okay, after 25 years only, I'll give a legal limit of alcohol. Who gave this guideline to the government? PSM, statistics. Now, if you're not understanding PSM and not having interest in PSM, my government will not be given an information that more than alcohol, the fast food is causing fatty liver. So who will give the information to the health secretary or the health ministry is the PSM people, the epidemiologist. So only then my government can put a ban or an age limit of consumption of fatty foods, because that's very essential. Everyone here, including you and me, have been eating fatty foods. Leave us. A kid is eating fatty food. A kid eating fatty food at 5 years or 6 years of age, pizzas, burgers, will have fatty liver at 15. Will have steatohepatitis 25, 35. Will have cirrhosis 40. Now the age of cirrhosis at 50. If I'm not looking at PSM, I might end up in having cirrhosis at 40 or 35, 25, 30 years down the road. You must have seen patients saying that they are becoming diabetic at 35, right? What's the reason? Not looking at PSM. Remember this, internal medicine or your medicine treats the patient of today. PSM treats the patient of tomorrow. Right? Remember this, write this in the front of your PSM book. Hopefully that will give you interest. Deepak, it won't create much of a problem. Fine, it will never create much of a problem. But yes, it is good for you. Parallelly, if you can put an extra effort during second year of MBBS or at least during a third year to make sure you read the first year again, that will make your basics comfortable. Mohammed Saif, I will take lectures on PW, and I have a channel of Ranjith Pathology. You can go there. I don't upload much of lectures there. You search on YouTube. There are multiple channels for pathology. Lonely Bird next exam. I am also waiting like you about information about next exam. Priya, is obviously you can get a job in government if you are from private medical college. There's no doubt about that. Shishan, how to prepare for next exam from first year of MBBS? Prepare for first year of MBBS. Put your heart and soul into medicine. Learn medicine the way it has to be learned. 100% you will do better in your next exam. Right? So the problem is all of us are looking at the destination. I want you to enjoy the journey. You enjoy the journey. Learn MBBS as the way it has to be learned. For university exam, for enjoying medicine, love of medicine. Definitely you will remember an excellent next exam. Journey is more important than the destination. If the journey is not good, the destination will not be right as well, right? Tajuddin, province is more than enough. There is no requirement for extra books. Great, Pratik. Gravity Gamer, no need. You need not remember Robin's cover to cover. See, no medicine book in MBBS should be read cover to cover. What is required for me is I think all of you as doctors. Once you enter first year of MBBS, you're not my student, you're my colleague. So for me, what I expect from a doctor is you're going to sit in a OPD. You're seeing a patient with anemia. I want you to remember iron deficiency anemia as the first cause, because that's the commonest anemia cause. So what do I write? Investigate for iron deficiency anemia. Okay, I have a peripheral smear, CBC, iron studies. So what do I expect in the iron studies? So these are the only things I want you to remember, or these are the only things which I take home message. So rest everything is a journey. It's not much required for me, right? So what is required for me for a doctor is the final step, what I want to remember when I sit in front of the patient. So put yourselves as a consultant while reading a textbook. So you'll filter out everything and you'll remember what is required. Gravity Gamer, prof exam, it's more of your presentation. Fine. So in prof exam, whatever book you read, you write paragraphs, you might not get a good mark. Any book you read, you present a prof exam theory part question very well. Like you put headings, you put a flow chart, you put important highlight marks, you'll get a very good mark, right? So any book is enough. Definitely Robbins is more than enough for your prof exam also. Ashwadan, integrating your college lecture with coaching notes. It's a very good topic. See, let's say that when you go into PW Med, you have two options. One is your live batches and one is your recorded one, right? If your college goes the same systematic way, in the way it is meant to be, like general pathology, hematology, systemic pathology, link your lectures and our coaching notes, because most of the time it will go hand in hand only. So if you say that one topic is taken in med earlier than in college, stick to that also, right? I'll give you an example. Let's say I'm starting with cell injury. In your college, they already covered cell injury. Please read that college, listen to the lecture in the college. If possible, make a note of it in the corner of your book. And when you have a lecture in PW Med, you also make a note of it. So if you find any extra points in the college, add on to the existing notes. So you have a normal one single notebook to which you add on any existing notes. You keep either medal lecture as a template or you keep either college lecture as a template. Add on to it existing thing. That's what will make your book very rock solid and help you to integrate your college as well as the coachings, whatever you are taking from, right? I do practice, Pratik. I am a head of a lab in Chennai, which is on clinical diagnosis and genetics. Ranjana, Robbins is more than enough. I'll tell you how to read Robbins. You'll definitely love Robbins in near future. There'll be an series on read Robbins with me. I'll hopefully we'll announce that when it's going to start, and definitely we'll read better. See, Rahul, when you are going to sit in front of a patient, what matters only is, one is knowledge, obviously. Second is the way to communicate. You cannot compromise local language at any point of time. That's undoubtedly required, right? Doesn't mean that it's not that you are reading a book in different language and practicing in different language. You're reading a book in English. Unfortunately, we don't have such rich resources in our local language. I hope in near future maybe the change happens, and I am up for the change, because I would want every medical literature in a language, because that makes our understanding much more better, right? As of now, I don't have the possibility to do that. So I read it, I understand it, maybe write notes in whatever local language you are from. Understand it, and when you practice, automatically local language is the only thing is required, right? Somewhere as of now, there's only need PG. Maybe you'll have next in near future. Merciful servant. Viva and pathology, that's totally dependent on the examiner. I will tell you my experience when I conducted Viva. When I was in my senior residentship in Jimma, I used to conduct Viva. I asked only one question to every student who enters. You want to pass the exam or you want to score marks? If the student is very honest and say, I want to pass the exam, I put 50 marks in front of them and I ask them to leave. The person wants to score more in the exam, then also I put 50 marks in the Viva, then I ask more questions. So it's totally based on the person who's taking the Viva. If they're good, they'll ask decent questions. If they're ugly, they're going to definitely grill you, right? Because iPad, buying an iPad is totally based on your thing, right? So for me, I would say that like I said before, I'm a bit of an old generation person. I would still feel a note and a pen is far superior to an iPad. But I feel iPad is better. You are good in digital and taking notes. iPad is a very, very good device which can stay with you for quite some time. It can stay with you for the next 10 years without getting repaired, right? If you use it properly. It's definitely a good resource. If you can afford iPad, please go ahead with that. Merciful Servant, Robbins is actually the most detailed book. There are books called as Golden, which is a USMLE review book, that is good. And there's a book called as Boyd. These are old books, but they are good. But I would say Robbins is much better. I'll tell you how to read Robbins, like I said, in near future. You have to read Robbins between the lines. Once you get the knack of reading Robbins, you'll feel that Robbins is more than enough. Nikunj, semester from Wednesday, all the very best first of all. There's no important points. You have done your work for the 1 year. Enjoy your semester. Write, draw diagrams whenever required. Don't write in paragraphs, write in pointers. Because no one wants to read paragraphs. If it's hepatitis, I'm looking for 4 points. If the 4 points is there, enough for me. Necrosis. What is necrosis? Types of necrosis, one example, enough for me, right? Go with pointers, that will definitely fetch you more marks than anything. Right? Great, Ayush. Thank you, Ayush. Ranjana, this method for reading standard books, it's individualized. For me, it's about, I like to read. I keep reading. Whether I understand or not, I keep reading. If I don't understand, sometimes I ask my seniors or my teachers. If they didn't answer, I go for Google. That's the only go-to method. But develop the art of reading. That's very, very important. It's not about reading standard books. Read anything. If you develop the art of reading, standard books also will be easier. Thank you, Oshanik. All the very best. Pratik, PYQs are important, right? The PYTs, right? Because for a competitive exam, there's only little much I can ask. So what's happening is, the problem what's happening here is, students are expecting the same questions to come which will not. Topics will be repeated. Undoubtedly topics will be repeated. Questions will not be repeated. Someone asked about septic shock. I can ask 100 different questions on septic shock. If you know septic shock, you can solve all the 100 different questions. But if you're just going to read 1 or 2 or 3 questions in septic shock, if you're not understanding the core concept, you cannot answer the 4th question in septic shock, right? If it's septic shock, I have fever, have the drop of blood pressure, positive blood culture. That's how septic shock goes, right? So remember the core concept, remember the main things, and obviously you can answer any question which comes. Ankit, Guide 10 is a good book, but if you're in second year, I would say you not go back to Guide 10, completely read it again. We'll read the necessary basics will be there in Robbins itself, fine. Murtaza, you'll have an entire season how to read Robbins with me soon. Vijay Kumar, I'm not sure if you can write JE because I'm a bit out of that arena. There are lots of people in PW who will be able to better guide you on JE during MBBS. I am not exactly sure about it, so I don't want to comment on that. Swastik, the best way to remember first or second year is see with the patient. If you're seeing a patient about your bronchiectasis, remember the lung, remember the auscultation, remember the lung, remember the lung pathology, pneumonia and bronchiectasis, and treatment, whatever antibiotics you use, you revise them, right? So it's case-based approach. You see a patient with diabetic foot ulcer, read diabetes, remember diabetes, remember the tubular maximum in the physiology. It's linking the network which you create by linking a patient to your basic science. That's what is going to make your foundation much more stronger, and it'll make sure that you don't forget things in future, fine? Okay, so all the very best. I took good amount of your time. I hope I was able to answer your queries. If I'm not able to answer any of your queries, please ping me on my Instagram channel or in the Telegram channel of PW Medan. I'll be more than happy to take your queries. Hopefully we'll see more and learn more together in YouTube. I'll make sure my only goal for this year is I want every student in the entire country to read Robbins for second year. We'll break the myth created by our old super seniors and seniors that Robbins is not doable. We'll make sure you will tell to your juniors Robbins is doable and we're going to read Robbins. Right? Great, great. Hope I could help, Ranjana. Thank you, Debashri. Man Kronika, Hashmogan is good. I'm not saying it's bad, but Robbins is better. Fine. All the very best, guys. If you have any more comments which you have not answered, which you have missed, please put in this comment box below below the video. I'll definitely answer your queries. Fine. Thank you for your time. All the very best. Bye bye.